how long are you gonna go? I'm flexible for the evening.
So we usually probably do about 50 minutes.
That's great. Yeah, whatever. Yeah, I'm gonna work out after this and do dinner, and yeah, I'm heading to the biohacking conference in Dallas tomorrow, which is like 2.5 hours away. So I'm driving there tomorrow morning, and yeah, I'm just chilling for the night. So I'm open.
Awesome. Good stuff.
Yeah.
All right. Well, thank you so much for joining me today. I've got a very special guest, Aaron Alexander, joining us from Austin, Texas, who we're just talking about, who's getting very hot there. But I've been meaning to have him onto the show for some time because he's got some amazing techniques and methods around how we understand and move our body and understand, the physicality of our body and how it connects into both, our physical wellness, but also our mental wellness. Aaron Alexander, thank you so much for joining me.
Thank you, man. I have so much admiration and respect for your work and the way that you communicate. So I appreciate you having me.
Oh, I appreciate it, man. I think we connected a few years ago, about, a little bit. I was on your podcast, but, I've been following your work for some years now. And, I really think there's this missing piece, right? Where we are talking about kind of, in the health community, we're talking about, food, we're talking about, supplements and nutrient pathways, and in dental, we're talking about structure, but, how we're moving the body and how that's connecting into what you call alignment, which I think is this really important piece and something that I think people can really connect into. And I really think healthcare practitioners themselves can get into this as well. So I'm excited to talk about this. I wanted to dive into a little bit about how you first started to move into this area. Like, what were your first kind of inklings into, writing your book Align and, figuring out that there was this movement piece that you could help people with? What was your journey in?
Start off like most male kids, probably in some way, like feeling just like uncomfortable, insecure, uncertain, who am I? Do I belong here? And got really into bodybuilding, and from that, like really like misaligned bodybuilding and very focused on the beach muscles, so anything I could see in the mirror. So I had like body dysmorphia around feeling like my pecs are too small and just like all stupid things. And so I put a lot of emphasis on training the front of the body pretty much, and then that led to all sorts of injuries, shoulder dislocations, just like general chronic back pain. I started getting a lot worse at sport. I grew up playing ice hockey in Pennsylvania and was pretty good growing up, and then got jacked, like put on like 60, 70 pounds of muscle. I was kind of like an oddity. Most people thought I was using steroids and such in school, which I wasn't. But I was just like, I got big. So aesthetically, I looked super impressive. But everything, my movement patterning was terrible because I wasn't practicing anything that actually mimicked human movement at all. And then that led into moving to Hawaii, went to massage school out there, and then went to college out there for psychology. I was just very into like, the mind and such. And then went to Rolfing school, which is, we can kind of talk about what structural integration is. It kind of overlaps with a lot of the work that you do, actually. It was just a process of like putting the pieces back together. So now it's been a 20-year journey of professionally just figuring out how to put the pieces back together. Because for the most part, most adults, we grow up pretty well like integrated systems. Like we go through our human developmental patterns as we're little kids, and we're laying on our back, and then we're rolling over onto our stomachs, and then we're going through, and then we're coming back onto our, into like a squatting position, and then we're bipedal, and we're going contralateral motion. It's this amazing symphony of movement. And then we're falling and we're tumbling and we're getting back up and we're reaching and we're squatting again. Like that's what the human does. That's like ideally any healthy human kind of mimics a child pre-kindergarten. I think in kindergarten, and when I was in kindergarten, there wasn't as much like screen stuff, but now that's obviously shifted with iPads and whatnot. So now it's becoming a visual issue as well. And your head suddenly starts to be jutting a little bit forward of your body. So now suddenly your body, you're already creating some level of compensation for your body to be able to hold that. Your shoulders start to get stuck in that rolled forward position. Your spine, your thoracic spine probably gets stuck a little bit more into that like hyperkyphosis. There's different terms for this: upper cross syndrome, lower cross syndrome. Your knees might start knocking in a little bit, going valgus. Your feet might start, everything kind of just starts to collapse when we're in that position too much. Something else that's really problematic with being in a seated position for way too long, seated in a chair, seated on the floor, like I am right now. I'm like down. You can see I'm on my little turf situation here. I'm in a straddle position right now. Sitting on a chair is problematic for too long. There's nothing wrong with the chair at all. The chair is beautiful. And you're doing it too long all day. One of the issues with that is you become toxic. Like you start backing up the sewage systems throughout your body, which your body conveniently through evolution or God or whatever, placed these lymphatic glands, which are dependent on contraction in order to be able to circulate that lymphatic fluid. They're placed into places in your body, locations in your body with high concentration of movement. So they're in the back of the knees, they're in the inguinal area, in the hips, they're in the stomach, which if you're walking regularly, you're going to be twisting that out with regularity. They're up in the neck, they're in the armpit, they're in the shoulder. All these places that a natural body throughout millennia of evolution would just naturally be rinsing and squeezing and twisting throughout the day. They'd be going through these like contralateral rotational spiral motions that just rinse those rags out throughout the day. So all of your stuff, my stuff, our stuff, kind of gets backed up with that movement patterning or lack thereof. So now it's been a process of kind of reversing a lot of that. So I'm in the same boat as like most people. I just am grateful to have made a business and a brand and a life around unwinding that. So to me, it's like on brand to have a conversation with you and choose to go outside and be in a straddle position, because we all ought to do it, in my opinion. I think it'd be good for everybody.
Oh, I totally agree. And this is why, I think your work's really important, because, I experienced this exactly. Dental practitioners, they don't even know it, but they're stuck in a chair and they're in this kind of tensed position operating for, the most part of their life. And like I experienced exactly a little bit differently, because I was kind of like, I did the gym thing kind of earlier in the life. And then when I got more kind of intense into clinical practice, I found that my shoulders began to lock up. I started to get neurological pain down into my hands, neck and back pain and hip pain, just the whole gamut, just everything locking up, because I was holding a drill for so long, so many hours of the day, and not understanding how all of these dysfunctional patterns were affecting me and how to unlock it. So I think it's so important. I think there's so much to learn, about how the body works like that, and how really that there's these dysfunctional patterns that we get into. How would you describe like the typical obviously you've got your own experience, like with your own symptoms and everything, like, so maybe we'll do that first. How would you describe what you were experiencing first when you were maybe in this dysfunctional balance with your body, and what were the symptoms that you were experiencing?
Well, I had joint laxity. I still do to some degree. So stability for me is really important. Working on anything that stabilizes the joint and emphasizes neutrality or centration. It's a 50-cent word for that. Just put the joint as in the middle of the fossa or wherever, whatever the girdle is. You're gonna get that thing as close to in the middle as you can, so that potentiates greater range of motion. When a joint gets backed up and it's kind of like at the edge of the joint, it causes the whole nervous system to say, holy crap, we're at the edge of catastrophe. We need to slow everything down. We need to reduce your access to power because we don't trust you. And you also don't have as many options to be able to move. So if your back is up against a wall, your options are to go, left, right, forward. There's no back. You don't have that. And so similar concept within the joints in the body. If you're not in a balanced, neutral position in just like standing, walking, playing sport, your body's going to make you less powerful. It's going to shut down your access to being able to create force. You're much higher likelihood of getting injured. And you have less options to actually be an athlete. You can't go as many directions. So I had joint laxity, and I was chronically pulling, and this is typical. Most people, you ever experience any kind of like joint dislocation or subluxation, it's going to go anterior out the front. just because like the nature of the shape of the joint. And our lives, for the most part, we're pulling our shoulders forward. So you're already, from like the balance of the tensional systems throughout the body, you're already kind of pulling those shoulders forward, and that head of the humerus is going to get slightly shifted anterior into the glenohumeral fossa there. And so then the rest of the body needs to respond to that. And the head is within that same pattern from life, sitting in chairs, looking at the phones. The head gets pulled forward. Now suddenly you have this situation happening where the muscles in the suboccipital space, they're hypertonic. The muscles up in the pecs, pec minor, pec major, all the like anterior delts, all that stuff, they're hypertonic. And then reciprocally, the muscles in like the mid traps, low traps, the muscles that are, south of the suboccipital space, they're all going to be hypotonic or inhibited. And then similar thing with the front of the neck. So it's like reversing that pattern is very typical for most people. It'd be really supportive. So I was representing that pattern. And then through playing sports, my shoulders started popping out of the joint. And so that was, like very, acute trauma that really sucked. It was very challenging. And you lose a lot of I lost a lot of faith in my body as well. When you feel like, if I don't know if I'm going to reach out to swat a fly, my arm might fall off. Like it sucks to be in that position. And so that's, I think ultimately all the movement stuff. It's like, what are the things that you actually care about? You probably care about being able to wrestle with your kids and being able to play and just feel like spacious and, at ease with your body when you get up in the morning. You're not just feeling everything's like crepitous and aches and pains. So the acute injuries of that, and then just a general ongoing gnawing back pain. And I think it's a product of, I think it's a lot of it's emotional stuff, the way that the body holds pain. If you're afraid, if you're sad, you ever have that situation where you're kind of bracing, it's some emotional event causes your physiological, the tone of your muscles to brace. All that gets packaged together. So growing up, most of us have some kind of troubled upbringing of some sort. I kind of experienced a bit of that, feeling unsafe, I think was a part, always chronically bracing, waiting for impact, waiting for the shoe to drop. And so the nervous system just can't chill, can't relax. And if it can't chill and can't relax, can't be in that parasympathetic state, sleep is going to be disrupted, and your capacity to heal and repair is going to be disrupted, and you're going to be having an ongoing signal to create change, and that's, I think, one of the coolest definitions for pain. It's just the body asking for change. There's I'm not going to tell you exactly what's happening, because whatever you think is happening is probably a little bit different than that. It's probably coming from somewhere else, but something's got to change. And whatever angle you come at it from, if you go at it from the psycho-emotional angle, that will probably create legit tonic change throughout the body that might allow better circulation and, allow your body to be able to heal and repair. If you go from a musculoskeletal lens and start working with body work, myofascial release, and new exercise and new training, that can spill back into the psycho-emotional. But for me, it was all pretty tense, essentially. And it was a lot of bracing, waiting for impact, not trusting the world, not trusting myself, and trying to compensate from feeling very insecure by packing on a bunch of muscle in a way that actually contradicts the way that the body naturally moves. It's very typical. It's just I'm an expression of that.
It's so interesting, that description of the forward shoulders, because I think that is just nearly everyone on the planet, right? And especially anyone that's had to kind of sit in any kind of office, or I'll use dental because I know there's quite a dental audience here as an example. But when you're sat forward and your shoulders, and for instance tensing with you using your fingers in a kind of a detailed way, and you're looking down, we use loops to try to counteract that. But there's this pattern that you develop in your shoulders that is totally counterintuitive to what the joint should be doing. I really want to jump into that, because it's something that healthcare practitioners experience, almost to the point where that I feel they think it's normal. And there is a lot of there's a lot of stuff that they experience, and they don't realize that they're actually experiencing this kind of feedback from their body telling them this isn't right. and that there's a lot of help that they could actually do for themselves if they did realize. The other side of it is patience, right? So, I mean, everything that you say here is kind of bringing to mind that we're looking at this from a development point of view, from the skeletal point of view, where the underdevelopment of the human jaw and the sometimes the growth of the maxilla, the use of the airways and the forward tilting of the head, and so these postures that we develop from underdevelopment of certain skeletal patterns in the craniofacial system seem to be contributing to that as well. Yeah. So, like we do a lot of correction work with this stuff in kids in development and adults too, but these patterns are all walking in the door. Every single one. These forward shoulders, head tilting forward, necks that are leaning forward. Tell us, I mean, in terms of what you kind of see with people that you work with, how are they experiencing this? For like, is it the back pain? Is it the shoulder pain? What are they mainly experiencing, or is it kind of mental difficulties that they can't deal with, or what are you seeing that people experience with this
person? So, like, I live in Austin, so people are a lot more tapped into the psycho, spiritual, emotional, universal, metaphysical, part. And so they might have different language and say it's an energetic thing or an emotional thing or an ancestral thing or whatever. I also, I work with a football player client in New York. So I'll go out there with him. And then New York, people have very different perspective on things, and so from them, it's much more mechanical, structural, linear, point A, point B, get it done. And so it really just depends on the language of the individual. So it's definitely like all of it. And the reality is it's both. Whether you have your lens focused on the body just being like a meat suit, and it's just a kind of like an objective system or like an object, and you prefer to see it through the lens of more like it's a complex system, it's like a car. That's fine to have that perspective, and you can get a lot done with that. And you can just look at the mechanics and understand, like, okay, cool. In order for me to get that joint neutrality, I'm going to need to maybe do some myofascial release on the muscles in the front of the hip, and maybe get into the iliopsoas, and I'm going to have to start to open up some of the space around. Maybe we'll get even dorkier and get into like the diaphragm and the pericardium and the relationship up into the neck, into the tongue, and that, like, all of those different spaces. And you can be very mechanical about it, and that will eventually, what happens with it is that spills into the way the person feels and the way that they relate to the world. Because our posture is how we communicate. Our facial affect is how we communicate. So if you have limited range of motion in the way that you actually express with your face or express with your hands, or your shoulders are chronically stuck into a position that ultimately is a defensive position. So if you were in a fight, naturally you would go into that rolled forward position. Everything would kind of tuck in like that. And your muscles are tied in to the cranial nerves and, the whole nervous system. When certain muscles are hypertonic, that's going to be sending a signal into your autonomic nervous system that, oh, Stephen is tense. There's some, probably some, I don't know what's going on, because my autonomic nervous system, doesn't necessarily have eyes other than my actual eyes, which are obviously feeding a lot of information there. But like the somatic body side of the nervous system is getting a signal that, like, I don't know what's going on. I know Stephen is pretty tense right now. So we should probably support him and be on his team and produce a bunch of, stress hormones in order to respond to this environmental stimuli right now that's causing him to be so tense. And so you can go in and start to work in like a backdoor approach to working with the emotional body, a way that a person just feels like their state, just through physical contact and restructuring of the body. And you can also, if somebody comes in, it's like, it's all energy and emotions, and I have issues with my mom and my dad, love that. We can also do that, and we'll probably do a lot of work around the gut, and we'll work around, deep work in that space. We'll probably do some deep breathing. We'll probably emphasize long exhalations. I mean, we'd have them start to use their voice. Maybe it's like, it's feeling like something's wanting to come up. There's like almost like this tension in your voice. Like, what would it feel like to scream right now? Just have a scream. And we'll go through these different types of other approaches, and they get up from that and they're like, oh my God, I feel so relaxed. My shoulders are like completely dropped. Like before we started the session, my shoulders are up to my ears. And you can't get away from the integration of the psycho-emotional, physical nature of the body. You know, all that matters is that a person just gets interested and gets started. And it's learning how to speak the different languages of different people. Some people respond very well to just mechanical structure. Some people respond very well to, you know, all like the softer Eastern type lens on things. So I guess both would be the response to what I see with people.
Makes total sense too. I mean, I see a lot in patients, the presentation of jaw pain and the presentation of temporomandibular dysfunction, and it's such a complex, both anatomical area, but then emotional area too, where you find that people are, they won't often realize, but they're expressing, their situation or a past situation through how they're sleeping, how they're breathing, and so forth, how the structure of their jaw actually works, and it fits into such a beautiful way of how the body is expressing itself, trying to get this message out that they often won't hear. So it's so true in terms of, that when you're thinking about pain, you really have to think about the deeper messages that your body's trying to tell you. So I love that way of thinking about it that you explained so well.
Something that's relevant, because I know I'm sure you've mentioned all the different resources around, and you talk about the shape of the jaw and the facial muscles and all the cranial bones and all that stuff, probably a lot. Or people have probably read the book Jaws, or read what's the George Catlin book, Shut Your Mouth, Save Your Life, I think is another one. There's so many different, like the book Breathe, James Nestor. There's so many different resources around the effect of tongue posture. Mewing is another cool resource to explore within that. I'd be curious your thoughts on mewing. Nose breathing, having access to be able to actually get air into your nasal passages. But good luck with all of that stuff if everything south of the jaw and of the nose is compensating and stressed and twisted, and it's all stress, and all the way down to the foot. The foot's like, oh my God, like your foot is cocked out 45 degrees and your hip is like chronically stuck in this whatever position, external rotated position, or you have some type of misalignment with the pelvis, and now your poor head has to like figure itself out, and your poor tongue, which is connected to all of that, has to figure itself out with a whole entire foundation of disorganization. And so you can do all of those different exercises, but again, do all the exercises for the face and the neck and the jaw and the nose and all that stuff, and it will trickle down into the rest of the system. And do all the stuff down below, and it will trickle up. But it's just a both. And you get these camps of like, this is it, I found Jesus. And it's like, you did find Jesus, this is great, and Jesus also lives over here. Jesus also lives over here. A lot of Jesuses float.
Jesus is north of the neck and south of the neck. Yeah, it's so true, because you're trying to, like, just clinically, you're trying to correctly say tongue posture. It's interesting because like you say, connects right to the toes fascial, in the fascial system. But yeah, right. But then you correct tongue posture, but like you say, there's this whole connection into how they swallow, how their cervical posture, how their shoulders are posturing, the whole thing. And like this starts to get out of the scope for a dentist, because we're like, okay, you need to go see a body worker. But there is this amazing connection. If they understand that, they can kind of go on that journey. But I don't think that's well explained anyway, which is exactly why I wanted to talk to you, is that, hey, we need to think about how these systems are interrelated and to work with both, because I mean, me personally, I've found such great such a great journey in understanding how the body connects into all of the things that I was trying to work with patients, but also for my own pain too. But then that picture for people to interconnect, that I think is just so important. We talked about breathing a little bit. One of the things that we look at a lot is kind of nighttime breathing, this unconscious, and we're talking a little bit about kind of, where, thoughts are coming from and so forth. How do you kind of relate into, say, look, let's talk about dysfunctional breathing patterns, because we talked about posture a little bit, which obviously leans into dysfunctional breathing. But how do you approach a breathing pattern that is unconscious and dysfunctional, and where would you go with that? Is that somewhere you would go into kind of emotional states and so forth? How would you look at that in terms of how to untie these things that are happening when the person isn't awake in this world and such?
I lean towards the physical, because that's where like my greatest depth professionally is. But I recently did a training called somatic breath work, where it goes more into like, some of the hyperventilation style breath work, and like breath holds and, long exhalations. It's kind of like taking the nervous system through a pendulum of all the states. And in that, they use a lot of cueing, like verbal cueing. So as a person's taking themselves through that breathing experience, they're bringing themselves into more of this sympathetic state. And in that process, I don't know how it works. I don't know that anybody knows exactly how it works. I understand it experientially. I can throw together some of like the chemistry with it, but it mimics a kind of like a fight, flight, panic type state, physiologically speaking. And it can bring up certain emotional baggage that you might have been holding onto for a very long time. And using things like certain words or cues and such, it's amazing how quickly just the right word, or the right suggestion suddenly just boop, it lands with a person in such a way. And suddenly, suddenly there's like a lip quiver, or suddenly you see the eyes are starting to water up a little bit, or you see that, their breath starts to change a little bit. And like the body is just, it's so magical. We really try to break everything down into Newtonian physics or some Cartesian reality. It's like, I understand everything. We don't really know what is going on. And if someone feels so confident that they really know what, like the deep intrinsics of the subconscious, what's happening in there, they probably just haven't figured out that they don't really know what's going on yet. We go through different iterations of that. But that being said, I'm really interested in all that stuff. And if a client goes into that direction, I'm here for it. And I'm just here to be supportive. And I love it. I'm like, this is so great. I'm so grateful and honored that you trust me enough to kind of be in this really vulnerable process. But the stuff that I do is mostly more, physically related. And so if a person's having breathing issues, and it's like a subconscious thing, like when they're sleeping, and I'd be curious your perspective on this, but one of the first things I'd be thinking about is making sure that they're breathing through their nose throughout the night. I find the most simplest solution to that is just throw like a small piece of tape over your mouth. That's not like a permanent solution, because ideally you get a person back into a resting tongue posture and jaw posture, so that naturally when they're asleep, it's just not an inclination to have their mouth gaping open. What do you think about that, actually? Because I know that you're more expert with that stuff than I am. That would be my most common suggestion as a starting point. There's a lot of other things that I would share after that, but baseline is like, just don't have your jaw hanging open and breathe through your mouth the whole entire night. Let's figure that out, and then we can build the other aspects on top of that.
Yeah, that's right, exactly. And with breathing, there's kind of a lot of one thing about it is understanding why the breath is happening that and this is physical, so it's
Exactly.
It can be nose blockage, it can be tongue posture, but it can also be tongue restriction, it can be skeletal underdevelopment of the skeletal system, it can be relationship of the jaw. You need to figure out and we can actually take a 3D scan and look at the airway and find out where the actual restriction in the airway is, and find out, okay, so this is most likely the choke point. There's support splints and so forth they can use to support that. But then, if it's just lip closure, then taping. But some people can't breathe with lip taping, so we need to kind of go a little bit further in. Some people need expansion. So there's a kind of a whole diagnosis process to understand. But most people can kind of tape the lips and get through it, and they can kind of test that with a little bit of exercise, right? And so that's a good approach for most people to test. If they can't, then maybe they seeing a professional may help them in that sense.
So then going like south, and there's more things I have questions for you if it's possible, but going south of that, if you just have the head in a like a hyperlordotic curve with the cervical spine. We were like, like that. What the hell does your mouth do? It's not that, like, the body's not that complicated. I know I'm saying like we don't know what the hell's going on here. I mean, like at the deeper levels, like ultimately, who knows? This is all a dream, whatever, but it's also super simple. So if you allow the head to kind of come into like a little bit more of a stacked position, and you release some of that tension in that suboccipital space, and a part of that, it's not going to just be just like one place you release tension. It's going to be a re-strengthening of the reciprocal side of that as well. And so you're going to keep on working down all the way down to the feet eventually. But to create the foundation for the head to be able to stack on top of the shoulders so that it can sit in a centrated, balanced, neutral position, suddenly the jaw kind of naturally just goes into close. And that, like, so when you tilt the head forward, like all of this connective tissue just pulls the freaking mouth open. So a great starting point would be likely getting some type of tool or finding a body worker or something, and just you get a couple of cross balls or a lacrosse ball. They've got like the little balls you can lay on the back of the suboccipital spine here. Little, like, you can feel like the little hard bony protrusions at the base of the skull where it connects into the neck, and just lay back on that and just breathe. Do that for a minute. You nod the head yes a little bit as you're doing that. You could visualize. Visualization is very powerful. There's a ton of different research showing that visualization is close to as effective as actually going through physical muscle manipulation. They did that with like thumb exercises. I think they've done it with free throws, and they do like the control group where they don't do anything, and then they have a group of people where they're just practicing visualization for a week. It's different depending upon the research, and then they have the group that actually goes through the motions. And control group, nothing happens. Visualization group, a significant amount happens. The people that are actually going through the motions, even more happens. Pretty impressive that the visualization is like not that far off from actually doing the thing though. So bring that into your practice. Visualize circulation, visualize cerebral spinal fluid, visualize a white light, like whatever works for you. Just visualize ease, spaciousness. It could get into other realms, cues, forgiveness, safety, security, like something is causing the body to get bound and get tight, and so that would be a starting place that I would probably be suggesting somebody works with, is in that suboccipital area. Another place is if that's going to be tight, look diagonally to the front side. What's going to balance that is going to be the muscles in the front of the chest. That also happens to be the most important place to start with lymphatic work. That's the area of lowest pressure for your lymphatic glands. So you want to clear this space to allow the lymphatic system to be able to circulate through the entirety of your body. If it's backed up in here, which most of us are backed up in there, then it's going to cause backup through the rest of the system. So that's amazing. We're in a structural posture, this forward head posture thing, or hyperkyphosis or upper cross syndrome, or all the different terms for it, that it doesn't look very beautiful. It's causing all this downstream issues of respiratory issues, which is a one-to-one relationship to your state, your emotional state. Maybe you feel anxious. Maybe you're experiencing sleeplessness. Maybe you're experiencing a lot of different things are tied into the way that we're breathing. Like most things, like our the way that we feel is directly tied into the way that we breathe. And so that would be a thing that I would be looking at next, would be opening up into the front of the chest, get down into the clavicle above and below, open up the pecs. So you could do like a doorway stretch, would be a beautiful thing. Make sure, and I'll shut up soon. Make sure as you're doing this doorway stretch, which people, even if you don't know what a doorway stretch is, you can figure it out. Reach out, grab a doorway, open yourself up, turn to the opposite direction, open up that space through the pec and the biceps and the flexors of the hand, and up into the neck, all the muscles in there, scalenes and all the things. And that is going to be a really beautiful way to start to release that tension, to allow the head to start to float. Ideally, the whole body that's what tensegrity is, a fancy word for. It's like the body is like this dynamic floating system. All the bones are kind of almost like floating within each other, and it's these tensional networks that are holding those bones up in space. It's like we're like in air. We're like in fluid and air, the bodies. And when we get hard and agglomerated and dense and dehydrated, that's when the body starts to form disease, and it starts to move in kind of like a clunky way, and inflammation starts to arise. If you can create space for the joints to go back into that space where the bones can almost like float in space, everything's able to circulate, everything's able to heal. You're sexier, you look better naked, you're more confident, you're able to express yourself. So that would be a thing, would be working up through there, and then simultaneously making sure that the ribs aren't flaring while you're doing that. So that's in order for the neck to have a good foundation to sit on, the respiratory diaphragm has to also be balanced. So think of this as like, you think of like in Rolfing school, they say like the tentorium cerebelli, I think is how you say that term. That's the highest most diaphragm being like horizontal connective tissue, and then going out down into the thoracic inlet, like where your head pops out of your torso. That's the next diaphragm. So just horizontal connective tissue. Then the next one would be the respiratory diaphragm, horizontal tissue. Then the next one would be the pelvic floor, horizontal tissue. These are all floors in your body. Next one down, the menisci, horizontal tissue. Next one down, plantar fascia, horizontal tissue. All of those floors need to be balanced from foot up to the very top of the head. Just like if you were engineering a building. It's so stupidly simple. Like it's not crazy. And ideally, as you're going through, say like the doorway stretch, you're like, okay, I'm going to tuck the ribs down so I can stack the respiratory diaphragm atop of my shoulders, atop of my head. Okay, I'm going to find a neutral pelvic position, something that would be supportive for that. A common thing, if someone's opening up the chest, is they're going to go into hyperlordosis with the lower back. If you're going to hyperlordosis in the lower back, that's probably going to run its way right back up to the cervical spine. Okay, cool. Fix the pelvis. All right, cool. Am I stacked and stabilized within my feet? And so you do that, just like that recipe, which obviously, if you don't already kind of know what I'm talking about, it'd be hard to like visualize all of that, but just get the idea, and then, we can share more resources and such. Take that general recipe into freaking everything that you do. Every time you go to a yoga class, every time you do weightlifting, every time you are a dentist and you're working with somebody, being aware of the location. Okay, are my shoulders kind of like depressed and dropped? Are they just hanging? Okay, are my ribs kind of flaring? Imagine I have headlights on the fronts of my lower ribs. Where are they shooting? Is one kind of like cross-eyed shooting up into the corner, and the other one, like have those headlights facing straight ahead. If you can run a little test for your pelvis to find more neutrality. All you got to do is just squeeze your butt cheeks. It'll probably cause the pelvis to kind of tuck a little bit, would be the most likely thing that's going to be happening with that. And then, okay, cool, great. Now see if you can kind of find that position that you just created through engaging the glutes, and hold that while you're going through some of those motions. And it's going to start to centrate or create some neutrality in those joints and more ease throughout the rest of the body. And then the body feels, healthier. It can rehydrate itself. It can heal. It can repair. And you have access to power. Like if your central nervous system, your spine, if there's a crimp in that hose, you don't deserve to have access to power. It's dangerous to have access to power. Your body needs to shut you down. You need to get tired. You need to get weaker, because if you were stronger, you'd probably freaking hurt yourself. So if you can start to realign all of those different joint segments throughout the spine, your body says, cool, green light, let's go. If you understand like basic pressure dynamics, how to create some intra-abdominal pressure in your midsection, which in order to do that, you're going to have to be able to organize your pelvis in relation to your respiratory diaphragm, in relation to the rest of the body. If you can create like a really strong cylinder of a torso, imagine it's like a Coke can. If there's a crimp in the Coke can and you press weight down on that Coke can, it just breaks. Your torso is that Coke can, and you need to take all of those acute crimps out. And so that would be like a hyperlordotic lower back or cervical spine, or a hyperkyphotic thoracic spine, like hard angles throughout the spine is going to be a pretty, like, usually a weak access to power. Global curves, amazing. Global side bending, global flexion, global extension, awesome. It's so healing and therapeutic for the spine. One strong, acute angle anywhere throughout the spine, the body should not trust that body. And so it'll say, cool, let's slow everything down until we get this resolved.
Such a great description, because it really kind of paints a nice simple picture from open mouth posture to the suboccipital. So like what's the muscular consequence of that? And so like for most people, like you said, releasing the back of the head there, it does miles for helping to understand, hey, like these muscles are in distress and they're strained by this posture that we're holding for most of the day through breathing patterns and so forth. And then the chest, which is exactly what I found for myself. I had neurological pain down my right hand into my outside fingers, and it was tightness through the chest and opening the chest up over time, doing that exact stretch, like getting into positions that was opening up the front of the body, that really kind of helped release that, and then obviously leading elsewhere into pelvic postures, and then also through into the legs and feet and so forth. So I think that's such a great way to describe that access point. So back of the head, the opening up the chest, and then thinking about the ribs.
Can I add another really quick? I know the last
go
one
for it.
isn't quick at all. This will be much tighter, hopefully. So the head, the scalp. So I do Rolfing, like manual therapy, body work. It's like working with fascia and connective tissue and such. The scalp is one of those places that I can't tell you. Now it's like an intuitive thing where I can kind of feel. Typically someone will have like their first rib will be like jacked up to their neck, or it just feels like it's literally just like a brick to get into all this stuff and around the traps and the first rib, and be able to access like anything around the clavicle, or they have like a lot of jaw tension, or anything that's like happening up here in the neck area. I can't tell you how many times I scratch a person's head for 5 minutes. And by scratch a person's head, I mean I'm lifting the scalp from the cranium. So I'm going through, and just a person listening or watching now, if you just go through and find, like, you can see, it looks like I'm wearing like a toupee, like I'm moving my head back and forth. That's good. Like, you want to be able to slide your toupee, your head, your hair hat back and forth. If there's any place throughout this system that it feels like, oh my God, it's like it's glued to my freaking cranium. It's a fancy term for that would be agglomerated. It's like glue. It's gunky. Just lift it. Just go through and start to literally find any place that feels gunked up, dehydrated, like beef jerky. It's not fluid when you touch it. And if you just apply some shearing force, so like kind of gliding back and forth, and then you could do like a pin and stretch technique where you wiggle the eyebrows as you're doing that, or you could kind of like open the jaw, open the eyes. You could work with the visual muscles. You could look up with the eyes and stretch the eyes out a little bit, ideally outside like I am right now, so you're getting sunlight to the eyes. That's incredibly healing. It's a whole nother conversation. But just doing that, it's like 100% of the time there's significant release of the traps and the neck and the jaw. 100% of the time. A very high percentage of the time, it's like close to full resolution, where I'm like, oh my God, like that thing that you had, and like your shoulder being jacked up your neck, we just worked with your jaw, your masseter a little bit, and gotten like temporalis, and we just like released all of the connective tissue around your scalp. And now suddenly all of this tissue down below it, like it has space to move. And so thinking of the body, it's almost like, this is a very like structural integration type perspective, but think of it as almost like you're wearing a bodysuit, like clothing, and it's kind of like bodysuits on top of bodysuits on top of bodysuits. And if there's a bunch of tension happening, I twist one aspect of the bodysuit, that doesn't happen in a vacuum. It's not just a scalp thing, or just a jaw thing, or just a tongue thing, or just a shoulder thing. The whole entire bodysuit kind of gets pulled to compensate for whatever that twist was. It could be scar tissue. It could be just kind of a chronic habitual movement behavior. And so what can happen if you create space anywhere in the body, it opens up like a vacuum, almost space for where there was tension to like relax a little bit. And there's a nervous system conversation there. There's a myofascial conversation there. There's a lot of different conversations there. Just being physically touched, there's a whole other, we could do a whole podcast about that. There's books about it. There's a woman called Dr. No, not Carolyn Leaf. She's another person. Tiffany Field. She wrote a book called Touch. I reference her in the Align Method book that I did. And she has just a ton of amazing information on the therapeutic value of literally just like being touched. We just need to get touched. Go take a dance class, go wrestle, get a massage, hug people, actually allow yourself to feel safe with physical contact. We have a massive issue culturally in Western culture because we see touch as we're either, I don't know if I can say fucking, but fucking or fighting. Like touch is fucking or fighting. In between that is this whole spectrum of healing, and that would be something that would be very valuable for people as well. A lot of what's happening with like body work, I think, is a lot of it's like you're physically being touched all around your body and cared for. And that's there's a lot of different levels to what's happening in that isn't just like merely mechanical.
Absolutely. And the connection between body work and some of these presentations that seem very chronic, then all of a sudden that you can get very kind of instant relief as you describe. But some of the explanations that you're giving here are simple enough for people to kind of even enact on themselves through daily routine, which is just it's just so powerful, because I feel like a lot of people get stuck in these patterns and they don't feel that their body ever feels good. And in reality, like there are solutions for this. To kind of round this out, like would there be any other kind of daily kind of recommendations that you'd have for people to help these kind of patterns?
Yeah, so many. I'm like, now I'm going. I'm like, oh no, Stephen, we're not done.
It's so many. I can tell it's so many. We'd have to do another one.
I mean, the first thing is just like staying with the upper body stuff, just like get a pull-up bar and hang from it for at least whatever. In my book, I recommend 90 seconds. I get that. I'm borrowing that from Dr. John Kirsch, who wrote a book called Healing Shoulder Pain. Or no, it's not healing. I think it's just called Shoulder Pain with a question mark. And he was an orthopedic surgeon that found, from what he shares in the book, he says that 99% of the patients that he would see for some type of shoulder impingement syndrome, he was able to completely resolve their pain and the shoulder issue and the impingement just with a very simple hanging protocol. So our shoulders they're structured. We're like these brachiating, gorilla creatures, ape creatures. And it's funny that like monkey bars is not an appropriate term because monkeys don't brachiate as well as humans do. So they'd be like a monkey bar. It would be better off calling it like a human bar or an ape bar. Like that's what we do. Like humans hang. Our shoulders are structured for that stuff. Our thumbs are structured for that. Our forearms are structured for that. There's something to it. What it comes from, like, I don't know why we're so good at hanging, or like we're physically structured to hang, but it's encoded in your genetics to be good at hanging off of stuff. And we don't even put our arms over our heads as modern Western human beings for the most part. And what happens when you do, that's why most yoga practices, you spend a lot of freaking time with your arms just up over your heads. It's like, why are our stupid arms over our heads all the time? It's like, it's so strange. It's because it's incredibly healing. And it's just something you could do that would be very supportive is just get a $30 pull-up bar from Amazon or wherever. Put it into a doorway that you regularly pass through. So if you're a clinician of some sort, maybe put it into your like office. It'd be a cool thing. It's like shows that you like care about your health. I think it's a great indication. It's a person that I would want to see personally. And when you walk through that doorway, hang for 10 seconds. Maybe you do a little swing on it and aggregate a total of 90 seconds per day. Just do that for a week and just see how you feel. And then from there you could stack. We didn't talk about much about like muscles that would be inhibited in that forward head posture situation. But you're going to want to turn the muscles in the posterior side of your shoulder girdle back on. They've probably been chronically hypotonic for a really long time. So working on, you can stand back up against a wall and just press your shoulders back, like isometrically break your hands through that wall. Just push, 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 push. Keep the ribs tucked the whole time you're doing that. Now drop your arms down 20 degrees. Now drop your arms down another 20 degrees till you're down your sides. And then you could immediately rotate your hands, press back from that direction. You could actually rotate your hands, press back from that direction. It's going to start to turn on all those different neuromuscular connections in that back of the body. It'll start to get the rhomboids to come online. It'll start to get the lats to come online. It'll start to get all the different trap fibers to come online. Your back of your body needs to be turned on if you want to be an effective human being. It's just the way it is. Like if you want to be strong, if you want to be enduring, you need to have strong legs and a strong back. Most of the modern world is very anterior centric because that's what we see. I want to have strong abs. I want to have big biceps. I want to have sick trap or triceps, pecs. Maybe I'll do some shrugs, build up the neck. And we assume that the whole world's not going to see the back of the body, but the back of the body is it's like what pays the bills. It's like that's where the actual power is coming from. And what if those posterior muscles are engaged, it's going to allow the space for the shoulders to actually live in their home position. It's going to allow the space for the neck to start to be able to come back. So that would be something to hang each day. Start turning on some of those posterior muscle fibers throughout the back. Keep the ribs. Your ribs are probably flaring as a general rule for a lot of people in the modern world. So start playing with allowing the ribs to kind of just rest down a little bit. Breathe into the side of your ribs. Put your hands along the side of your ribs. Breathe horizontally. I'm just shotgunning a whole bunch of things. Hopefully any of this sticks. Breathe horizontally instead of vertically. So if we're breathing vertically and the breath is kind of coming more up into the neck, more up into the chest, that's going to be indicative for your autonomic nervous system that you're stressed the freak out. Calm it down. Bring that breath not into the belly, because the belly is not built for breathing. The belly is built for digestion and other things. It's the diaphragm that breathes. So bring the hands on the sides of the ribs and just allow that lateral expansion with the sides of the ribs. So you can bring one hand to the back, one hand to the belly. Feel that the three-dimensionality. Now I'm breathing front to back. I'm breathing side to side. Emphasize your exhalation. That's going to start to down-regulate everything. You could start to hum as you're doing that as well, just stacking different variables. Humming is going to increase production of nitric oxide by 16-fold or something stupid like that. And then spend time on the ground. I've spent this whole conversation for the last 50 minutes pretty much just doing what Western culture would be considered yoga. I'm in a Sukhasana position right now. I was in a 90-90 position before. I was in a straddle position. I'm also doing this outside, so I'm getting sunlight exposure to my eyeballs and to my skin, so vitamin D, all the different things. That's incredibly supportive for actually changing the shape of the eyes, having sunlight exposure to the eyes. It changes the shape of your whole body. It changes the shape of your cells. So look at sun as an actual physical, mechanical nutrient. It's it's interacting with the dermis and the cells and the mitochondria and everything. It's changing you in the best way possible. So think of the sun, it's almost like a massage. I want to go out and get a sun massage, as opposed to the idea that I should be afraid of the sun for all these different reasons. Meanwhile, people are now afraid of the sun, but we're getting more skin cancer. So I don't know what's going on there. It's a whole other conversation that I don't have enough depth in that realm. But my suggestion would be just spend as much time outside as possible and do all the other crap I mentioned. I think that would be a decent starting point.
So much great information there that lends into I think we just scraped the surface there. We're gonna have to talk about this again, because the logic of the interconnectedness of the body is just it absolutely makes total sense. But then the practicality of what people can actually experience by just going through some of the simple steps that you've described here, I think is just so important. So, I really encourage anyone to kind of dive into your work, but we're going to have to talk about this again, because I've got so many kind of ideas and questions now that we've started the conversation. But where can people find you, Aaron, if they want to dive into your book and find you online?
Yeah, thanks, man. The book, if people are into books, is called The Align Method. There's an audio version of that as well. And then if people do want to go into more movement training, self-care techniques, practices, There's the first week of the Align Method program. It's a 6-week program. The first week is free, so people can check that out. There's a movement assessment, and then it goes through some fundamental movement patterns and some techniques in there that I find to be supportive. I think other folks will as well. That's alignpodcast.com/AMP, Align Method Program. Podcast is called Align Podcast. So that's pretty much Align Method, Align Podcast. You'll find all the things.
Thank you so much for all your work. Like your journey is really kind of, elucidated such important information about the human body. And I really, this information has to get out there. And so we're going to work to do that. So we're going to have this conversation again. So
Yeah.
Hope you have a great day, Aaron.
Thank you, brother.
And we'll have
Appreciate
to talk again soon.
Yeah, for sure. Thanks, man.
Thanks, mate.